Hey Angie, have you heard about how the role of pharmacists is changing? It's pretty exciting, especially with the way healthcare is evolving here in Indonesia.
Yeah, if we read about that, it's no longer just about handing out medicine. Pharmacies are going to be much more involved in patient care, helping them get the most out of their medication and even supporting their overall well-being.
Exactly. I mean, even in Indonesia, with all the chronic diseases like diabetes and hypertension becoming more common, pharmacists will be key in helping patients manage their medication properly. Will be part of the team, not just the one giving on prescription.
Right. And it's not just about giving the medication, but also making sure patients understand how to use it. For example, many people in Indonesia, especially the elderly, don't always know how to take their meds correctly or they forget. In the future, we'll probably be doing more patient counseling, helping them stick to their treatment plans.
That's true. Like in the case of hypertension, for instance, many people don't realize how important it is to follow their medication schedule. So it will up to us to education on how and when to take their medication, explain the risk of not following the instruction. Yet a more hand-on rule.
Actually, and with the risk of non-communicable disease in Indonesia, like heart disease and diabetes, we could play a bigger part in prevention too. We might even help with things like lifestyle change, advising on diet, exercise, or smoking cessation. It's like moving from a reactive role to a proactive one.
I totally agree. And it also about improving the quality of care. Take the PGS for example. Even though the insurance system is helping a lot of people, the service quality is not always the best. Pharmacists can help break that gap by being more accessible to patients and guiding them through the system.
Yeah, and we also need to show that we're not just an additional cost, but a valuable part of the healthcare system if we can prove that we're helping patients stay well and avoid complication. It'll make a strong case for expanding our role.
Exactly. If we can help prevent hospital admission or medication error, for example, that's also how important we are in the healthcare team. We'll need to back it up with evidence, like how patient outcome improve when pharmacies are involved.
It's going to be a big shift, but it's exciting too. Look at countries like the UK or Australia pharmacies. They are already doing a lot more in terms of patient care. Why can't we do the same here? Right?
Yeah, for sure. And the healthcare system in Indonesia is still growing. So there's a whole opportunity for us to step up and be a part of that change. It's not just about understanding medicine, but also about how to work with patients and other healthcare providers to make a real impact.
Definitely, if we're able to take on this role and show the value of pharmacy beyond just dispensing medication, we could really help shape the future of healthcare in Indonesia.
I'm excited about it. We're entering a field that's on the verge of big change. We just need to be ready to take advantage of it and improve our work.
Absolutely, let's make sure we're prepared for it. This is our chance to make a real difference in the healthcare system.
Agreed. The future of pharmacy is bright, and we'll be at the forefront of it.